right. So thank you so much, Sarah, for sharing your story and joining us for our donor interview. Um, I had the opportunity of meeting you just a year ago, but your story has been so inspiring to me in my career. And, I really wanted the opportunity for our Oxnard community to be able to hear why you decide to support and remain engaged with Oxnard Health. So, let's just start from the beginning. And I would love to kind of hear, your Oxnard story and how you decided to get involved with Oxnard.
Okay, so when I was diagnosed with liver failure as like an infant, I was 6 weeks old, and I had a Kasai procedure because I have biliary atresia, which is a liver condition that happens in utero, and there's no cure for it except a transplant now. They don't really even do Kasais anymore. So my Kasai worked until I was about 27. And then when I was 27, I felt like the rug was ripped out from under me. I couldn't walk. I had no idea even who I was. I had so much ammonia buildup that I barely even knew my own name. And this happened within like a month. So I was listed at UCSF here, and the wait was about 2 years. And I was told I had 6 months to live. So obviously that's not really manageable. So a surgeon here told us about the Mayo Clinic and Ochsner, and we looked up Ochsner. And my dad is in the biotech field, so he actually emailed a surgeon at Ochsner who actually ended up being my surgeon anyway. And he just
Wow.
told him, if you can get her down here, then come. So we figured out everything with insurance. I came down, I think like a month later. And then in 11 days, I got the call while sitting in the atrium of the hospital.
That you had a match, correct?
A liver waiting for me, yeah, or a match, yeah.
Yeah, that's amazing. And tell me, since that experience, which is obviously life changing, what has been kind of your inspiration allows you to want to be engaged and want to support. Obviously we have grateful and amazing physicians. What is your motivation to continue to support philanthropy here at Oxnard Transplant?
I just feel so connected to them. I had never been to New Orleans before, actually, and it's hard going somewhere else and waiting and only having your immediate family. I mean, no one can come and visit you because it's far. It's literally almost across the country, pretty much. And they just made me feel like family. They were so
Yeah.
welcoming. They um, had me meet up with people from the transplant games that had already had a transplant. I met a wonderful woman who had had a heart transplant almost 9 years earlier, and she just gave me hope. Like, that I was going to be okay. I love everything about it. My team was amazing. I couldn't ask for anything more. And I want to help people. I want people to come there and know that it's not the end, and it's actually just the beginning when you get there. So they were just amazing to me. I could never ask for anything more during probably the worst time of my life, but going to Ochsner was amazing, and it made me stronger. Um, since then, I've done so much and I've seen so much. I've seen the birth of two more nieces. I finished an MBA. I'm in another master's program now, and I wouldn't be able to do any of this if it wasn't for Ochsner.
So yeah. And I know we recently talked and you just celebrated 6 years. Is that correct?
5.
5 years. And talk
Yeah.
to me. I know you showed me this inspiration and amazing video of what you do annually to honor your donor. Talk me through what that is.
So I met her. I always wanted to reach out, but there's a timeline that you have to wait. And I was actually in the process of writing the letter when I got a call from Oshner saying if I wanted the letter from the donor family. And I, of course, said yes. And so it felt like it took like a year to get here, but it was actually like a week and a half. So I got the letter, and it was from her mother. And she told me her name and how old she was. And so I looked it up on the internet. Um, and I, found out who she was. And then I didn't really talk to her much after that. She left me her email and I emailed her, but she didn't respond. And then I would say that was like February. And I think like in maybe April or March, she found me on Facebook and she added me and she sent me a message and asked me if I was willing to come to a benefit that the second one that they were going to have for her, to raise
Wow.
money for the condition that she had. And so I said yes, I would come. So on July 9th of 2016, which is actually my birthday, I met my donor, Laura
Mhm.
Lynn Picard, who is right here, and I met her whole family at a big benefit for her, and it was one of the most amazing days of my life. I don't know if getting the call or meeting her family was more amazing for me. I think meeting her family was probably it gave me a lot of closure.
Yeah. And I love the celebration of life that you do, that coincides with your anniversary, the releasing of balloons. It's so amazing and kind of brings it full circle.
Mhm.
How you share your gratitude not only through philanthropy, but acts of remembrance and kindness like that. So I love that, and I love that you share gratitude in so many different ways and show your philanthropy in so many different ways. So thank you for that. What would you share with people or prospective people who want to support, transplant? What would you tell them in terms of your experience in
I would
supporting?
tell them that although transplant is, a surgery and, it's not a cure. So after um, you take medicine for your whole life, and the medicine is so expensive. It's so expensive, thousands of dollars. And a lot of
Mhm.
times, the reason why there is rejection in transplant is because patients cannot afford their medicine after. And it's a huge
Mhm.
issue. Um, these drugs are daily. You can't miss them. It's not like, you can miss 2 days and it's fine. You have to take them every day in a timely manner. You can't double up and just if you don't have good insurance, or if you were out of work because of the transplant and you don't have the financial stability to afford your medicine, it's just you got this organ and then it's like you don't even know what to do, because what if you can't pay for your medicine and you feel like you have to space it out, which you cannot
Right.
do. And if anything, I think that's the most important piece, is after you have to honor the gift, but you also have to be able to pay for your medicine after, because you have to take it. Like it's not an option. It's not a you can half it or take it every other day. It's not That's not an option. You have to take it every day.
Right. And that's why you decide to give to patient assistance, which I know you and your family have done consistently, and you also help me fundraise. Is that one of the reasons to kind of help patients kind of pay for that medication if it's necessary?
Yes, I think we found out about it about a year after my transplant, that we decided to split our donation to the patient assistance fund, just because I met so many people there. that drove 2 to 6 hours to come to Ochsner to be seen there
Mhm.
for one appointment and, had to go home the same day and, couldn't
Mhm.
afford to stay in a hotel or stay there and driving back and forth. I mean, here I know I had appointments when I was waiting, I would say twice a week, and it is
Right.
UCSF is like 35 minutes from me, and when you're literally on death's door, that's 20
Mhm.
minutes is a long time to be in a car, and I can't even
Yeah.
imagine having to basically make a day's trip for one appointment, maybe 2 to 3 times a week. So, I just think that anything that can help someone, um, even help the caregiver as well, because you have to have a caregiver when you have a
Absolutely.
a transplant as well. That's another part of it.
Yeah. And I always wonder like what can we do to take care of our caregivers? And it's something I'm also kind of passionate about in terms of philanthropy. So the fact that you bring that up, I mean, that's another 5, 10 reasons to support. And so I'm glad that you have. Um, I am incredibly appreciative of you. And I am fortunate enough that you're able to share your story with us. And I want to know or understand like ways that you think patients and families can give back. I know philanthropy is one, but talk me through some of the things that you've decided to do to honor her memory and kind of give back in your way.
So we do the balloon release every year for her
Mhm.
here. And then when we were at Oshner, there were mini fridges in the rooms, and we asked like, "Oh, that's really nice that you have them," because we would put like I don't know string cheese or soda, whatever you want to put in there, because my family stayed with me the whole time. And one of the nurses told us that a family donated them, and my mom was like, "Oh, that's so cool." So we actually wanted to donate microwaves, but you can't put those in the room. So
Yeah.
we remember, yeah, you can't have them in the room. So we remember that when we were there, the nurses didn't have a coffee machine. So when we came back
Oh,
home, we bought
yeah.
them a Keurig. Yeah, their coffee machine was always broken, so they had to go to another floor. So we bought them I'm sorry. So we bought them a Keurig, and every year we send, them the pods, during Nurses Week, or last year we just brought it when we came just because I tried to send it
Right.
from Amazon. Amazon wasn't having it, so, we just did that, and, you know, we I tried to give as much to Ochsner. I actually don't do any philanthropy here for any donor stuff here, any donate life in California, just because I feel so connected to Ochsner, and any money that I want to give, I want to give to Ochsner. I I don't feel a connection with the hospital here. I just I can't imagine having a transplant anywhere else. I can't even imagine 5 years later that I'm still, so connected to them, like, so connected. It's just I mean, they saved my life, and my family is so grateful for them. It's just amazing. I've never
It
been
is.
to a hospital like that.
It's family. Who do you remember? And I know there's so many doctors and caregivers and nurses that you remember. Who do you remember by your side as a part of your family? Shout them out.
So Ari was the one that my dad, Dr. Ari Cohen, was the one that my dad emailed
Yes.
first off. So he was the face of Ochsner before we even went
Mhm.
there. He was so helpful. He's a surgeon, and he got back to us, I think, minutes after my dad emailed him, and they were talking back and forth and looking at numbers and seeing if it was better if I stayed here to wait or go there to wait. And then when I got there, Dr. Emily was amazing. Also, she was actually another one of my surgeons. She
Yeah.
was amazing. She's just so calming and just so great. the nurses, Danielle was my nurse for a lot of the time. Megan was my nurse for a lot of the time, and another woman, Kelly, who actually moved to Florida, but she was my
Wow.
nurse a lot of the time there. And I actually still talk to her. I talk to her, a lot actually for only being with her because I was only at Ochsner for 6 weeks, so I wasn't there for that
Yeah.
long. Um, but they made such an impression on me. I never, I never thought I would go there, and I thought going there was going to be horrible because I didn't have my friends or I mean, my family came, my mom and dad came and switched off, but I didn't have any friends. But I made friends there, and it's just I anyone thinking about going there, it's the most amazing place to have, in a time that I was so scared and so young and I had no idea what was going on, but they engulfed me, and it's just I don't I think that I would never want to lose this experience, even though it was so traumatic. But I think it made me who I am going through this and going through it with Ochsner too. It's just, I know a lot of people that have had transplants in numerous places, and no one's story from Ochsner is like mine. No one's. No one knows their surgeons personally, or, their nurses personally, or talks to them after really. And I mean, I'm not even seen there anymore. I have not been medically seen there since the day I left.
Yeah. And the connection's still there, and the
Yeah,
gratitude. I mean, one
I,
thing that,
yeah,
yeah, it's amazing. One thing that
I go
brings us
back
all
to the floor.
together is this, I'm sorry, go ahead. No.
Oh no, it's okay. Yeah, I go back to the TSU floor every time I go there just to see if there's anyone that needs like talking to, because I know that was really helpful for me because livers mostly are not a lot of young people. It's either babies or older people. There's not a lot of like 20 to 40-year olds. So I
Yeah.
think it's really, for me, it was really helpful to see, um, a younger person or just anyone that had made it through. And, you think
Yeah.
it's even after surgery, you're not the same for, I would say a month, but I mean, I was happy they let me go home so quickly, but it was also, I never thought that I would be sad to leave there. And it was hard to
Yeah.
leave.
They became your family, you know?
Yeah.
And what a wonderful blessing and experience that is to have such caring and, amazing physicians that you didn't want to go home and they still remain your family.
Yeah.
Every time you come back for the
Yeah.
holidays and, you shoot out names as soon as I see you. And I know they still connect with you as well. So, obviously they appreciate, your gratitude and we appreciate your gratitude for giving back to them and kind of sharing how grateful you are. And I appreciate that in you, Sarah. Is there any messages or anything else that you want to share, to our Oxnard community?
Um, just I hope to see you guys again as soon as I can. As soon
I
as I can
can't
get out
wait.
there.
I know.
I know.
Yes. And thank you for all that you do. COVID is a crazy time and we're all trying to get through it. I know you're out in San Francisco. One thing I have to share is you supported transplant with a pizza party. How amazing is that? Finding unique
Oh
ways
yeah.
to give back, sharing your gratitude, and we are grateful that you and your family decided to do that during this crazy time for transplant. So thank you for that too.
I
I have
forgot
to
about
share that.
that. Yeah, I forgot about that. Yeah, it's just, I mean, I know how hard they work when I was there just for transplant, and I can't even imagine having a pandemic on top of a community that's like immunosuppressed anyway, and then having like a crazy
Mhm.
virus to deal with also. So,
Yeah.
we're so grateful to them, and anything that we can do, um, we just owe it to them. I mean, it's not even a question here. It really isn't.
Mhm.
It's just something that we do. It's not even are we going to? It's just we just do it here. It's just part of us.
I appreciate you in that. Thank you for everything. I cannot wait to see you again when times are better, so we can celebrate with transplant at the holiday party. And
Yes.
please take care. And thank you for all that you do. So appreciative of you.
Same to you guys. Stay safe.
Thank you. Take care. Okay.